you don't feel heard, and you don't, correct me if I'm wrong, you don't feel heard, and you don't feel as though they actually care.
Right, they're not doing enough.
They're not doing enough.
Right, they're not doing enough. I can say that, they're not doing enough.
So one of the things that we do that's incredibly important to us is that we're actually in the community getting the understanding of what the needs of our seniors actually are, versus having someone that's consistently calling over the phone, making changes, promising all these various things. We actually engage in the local churches, local community centers to make sure they have a visible place, a person that they can call, contact. We give them all our cell phone numbers, and a part of what we're doing is we're creating a documentary. In that documentary, we're identifying, we're hearing straight from the consumer, a Medicare beneficiary, as to what the issues are. We take that information and we try to give that information to the insurance plans, to the community, as well as to the lawmakers that are creating these plans to make sure they're meeting our needs. So today we have with us Mr. Thompson at one of our local events. How you doing today, Mr. Thompson?
I'm doing great. I'm doing
great. Yes. Now I was joking with him about this cane. When we first came in, I put my hands on him and told him, "You are healed. Get up and walk." He looked at me. I thought he was going to hit me with that. I thought he was going to hit me with the cane. But you know, Mr. Thompson, what we wanted to kind of do is just get an understanding of what your experiences are like. Hear it from the horse's mouth. So we do not want to say the name of the insurance company, but we want you to kind of share what your experience has been like. So let's just talk about the last time you went to the doctor. What did you go for?
I have diabetes.
Okay.
And I haven't been under my A1C is kind of high.
Okay.
Because the company don't want to pay for the medicine that the doctor prescribed for me.
Okay.
And so I haven't been taking my medicine because they won't pay for it.
Do you remember the name of the medication? Is it a GLP-1 like Ozempic, Wegovy?
No, it's like metformin, but it's like a lot of medicine together, mixed together.
Okay.
It's like
it's a compound.
Right. It's 1,100 milligrams.
Okay.
And every time I go to the doctor, since February, the doctor prescribed me the medicine. When they sent it to my pharmacy at Living Care, he called me and said that they won't pay for it. So I haven't been taking it.
So have you been taking a substitute? What did the doctors say when you talked to the doctor? Say, hey, this medication is more than I can afford. What are my options?
They try to give me like what you call that?
A generic?
Yeah, a generic. But the generic is not strong enough.
Okay.
It's not strong enough.
So how's it? So February, we're in October, so that's
quite a bit. That's a long time.
That's a long time.
Yeah.
How you been feeling?
I have some medicine that, well, they wasn't paying for it. I was with
another carrier that was paying.
Right, another carrier that was paying for it. Yeah, another carrier that was paying for it. And once I got on disability, SSDI.
Yes, sir.
And I had to drop the they call it the MO, like like the Social Security part.
Yes, sir.
Like what do you call it? It's Medicaid or Medicare.
You're on Medicare. This is a regular Medicare plan. How young are you?
I'm 62.
You 62? Okay.
I'll be 63.
So it would be SSDI that you're on. Now you understand when you turn 65, all of this changes. Your mileage you're gonna get is gonna change. Your access, you're able to choose all over again. It's like
I didn't know that.
Yeah.
No, I didn't know.
So one of the things we've seen here with Mr. Thompson is that who do you have when you have an issue that you can call? When you start having these problems, who are you talking to?
The company I go to?
Yeah, when you found out, they told you I couldn't, you said, I can't afford this medication. And this happened in
My
February.
doctor.
Okay. Do you have a healthcare advocate like myself that you're currently working with?
Yeah, he better medicine.
Okay.
Do I have it over there?
Yeah, you have it over here.
Yes, that's where I go to.
So what Mr. Thompson experiences is what many people experience, because he doesn't have the same person that's advocating for him on a regular basis. So we'll be working with Mr. Thompson this year. So what that does, number one, it gives him our cell phone number to call whenever he has an issue. Because if he'd have been a part of our program, our organization, you'd have said, hey, LaQuentin, my medication, this in February, my medication is, I can't afford it. And then what they're prescribing to me is not good enough. So one of the things I understand is that from January 1st to March 31st, if he'd have called me in February, I would have changed his plan the next month. So he could have went back to the plan or another plan that would have paid for your medication. And so here we have, this happened in February. Tomorrow is October.
Right.
That his needs are not being met. So the thing we really want people to understand is that there are people out there like myself that are there to help you. Many times people answer the phone, someone will sign over the phone, you never hear from them again. Or somebody come by and see you never hear them again. That's why we give the cell phone number. And you look at my cell phone, who is that? That's my daughter.
Right.
So that's what my personal cell phone. So wherever I go, this phone is going to be with me. So there are definitely options that are available. And one of the things I want to emphasize this year is there are plans that are called CSNP plans. These plans are designed specifically to help people on certain chronic conditions. Mm-hmm. So diabetes is considered to be a chronic condition that identifies the medications that you're taking in with your previous diagnosis. So many of these, like right now, does this plan provide you with groceries?
No.
Okay.
Well, they have $40 every 3 months, I think.
Okay, $40 every 3 months. So there are plans that will provide you with OTC, transportation, hearing, dental, vision, and up to $80 or more quarterly for groceries. So it's almost double. Plus, some of those plans will make sure you get your medications covered.
Right.
So, do you go see a specialist?
I do what do you call it, cardiology in my heart.
So you have issues with your heart as well?
Mm-hmm. I have blood pressure, but I have neuropathy.
Okay.
My blood pressure goes up and down, such a way. Like when I lay down, sky high. Sit down, it's almost like normal. When I stand up, it drops big time.
Got it.
Yeah.
How often are you going to the doctor?
They usually give me every 3 months.
Every 3 months.
But really, it's frustrating me because the doctors I go to, better nursing, they really don't do nothing.
So what's your experience like when you walk in? When you walk in, how much time is the doctor spending with you? Or do you see a nurse practitioner?
Right. I think for 5 years, Dr. Moses is my the PCP. I only seen her one time. They were about in March. Out of all them years, one time.
So
I didn't see other people.
So one of the things I want people to understand, if you don't feel as though you're being treated the way you're supposed to be treated, the way you want to be treated, you got choices, and that's what we do as healthcare advocates. If you give me feedback that you're not happy with it, that you're not getting it better, your numbers are not where they should be, you can't get access, that's what we're here for. That's why we consider ourselves to be healthcare advocates. We basically fight for you. If you need help reading a letter, if you have an issue with the cost of your medication, if you have issues with transportation, dental, vision, all those things we're there to support. But most importantly is a doctor is an advocate. He is a tool for your health. The person is honestly responsible for our health. We are responsible. So it's up to us to put another person in the game. You watch football at all? So on a football team, if the head coach doesn't like the performance of the player, what does he do?
Take him out.
Take him out. Trade him. If that head coach doesn't like the assistant coach, the coach of the running back, the coach of whomever, he get rid of him.
Right.
But he's still the head coach.
Right.
You're the head coach of your health. So it's up to you to work with us to say, okay, is this coach, your nurse practitioner, your cardiologist, your endocrinologist, are they meeting your needs to get the results that you want? If they are not, guess what we need to do? Change coaches.
Change coaches.
Change coaches.
Okay, I got a question. Okay, when it comes, like my disability, my SSDI,
Yes, sir.
do they have anything to do with them?
No.
Oh, it don't?
No.
I didn't know that.
So income levels, we won't ask you that on camera, but income levels determine if you're able to get additional support. So the additional support sometimes can pay for your medication. You don't have to even worry about your medication, but it depends upon how much you're getting in SSDI. I'll ask you that off camera. But there's various levels of support, extra help you can get, whether it be what we call LSI, which is low income subsidy. What that does, it pays for the medication. You have something called SLMB, which pays for medication, a few other things, as well as, depending on the level, you can possibly get your Part B premium back. And then there's other levels of Medicaid that you don't pay for pretty much anything.
That Part B premium, that's that $170-something they take every month.
The $185 they're taking, it's going to go.
I ain't know that.
It's going up this year.
Oh, for real?
Going up this year. So let me ask you this. I don't want to hold you long. Just one more question. If there was anything you could do to change about your current health plan that would make your life much better, what would it be?
What would I do?
What would it be? If you wanted something about your current plan to change, what would be the number one thing you would want to change? Outside of paying for that medication that you're not getting paid for.
I don't know. You got me on the spot right there.
Okay. That's okay. That's okay. So, I know one thing you said.
I want to change. Yeah, I want to change because they're not really doing nothing.
The engagement. Then what that means is the engagement, meaning that you don't feel heard, and you don't, correct me if I'm wrong, you don't feel heard, and you don't feel as though they actually care.
Right, they're not doing enough.
They're not doing enough.
Right, they're not doing enough. I can say that, they're not doing enough.
Okay.
Because I got one thing, I don't see on camera, but every time I go to the doctor, knowing I'm a diabetic, they supposed to check your feet, they never, in all them years, never check my feet. So
one of the things that I'm going to commit to on camera is we have a checklist. Now there's a carrier I'm thinking about now that has excellent customer service, and they have plans specifically to support diabetics. We're going to make sure we get you connected. We're going to make sure we get you connected. We'll be here week after week after week. And we'll schedule time to work. What we need to do is we schedule a time for me to make sure we get your list of your medications. And I can tell right now you're not too crazy about your doctor, so changing doctors wouldn't be a big deal to you because you've only seen her once in 3 years. And I know that doctor. Don't say her name again. I know her, and that's an issue. She's an amazing physician.
When I name?
No, I know her name. You said her name.
Yeah.
I'm not going to repeat it.
You know her?
I used to send a lot of clients to her. She's an amazing, but she just has too many clients.
I know.
She has too many clients.
I'm trying to think what I was going to say. I had 2 strokes. I got short time memory now. So
that's why you need someone like us that understands your situation and that can be the advocate for you. Because we come in, we take notes, we get an understanding of what's going on.
So you know her, you know where she at, and
humble.
I know, but
I know where she. I know exactly where she is.
I don't want to put it on camera.
But we can delete it out. We can delete it out.
You can delete it out.
Yes, sir.
It's like they're not for us. I don't mean to say it like that, but
that's how you feel.
Yeah.
And the reality is, unfortunately, we are in people have biases, right? People don't treat all people the same.
Right.
That's the way it is. Even with people that are African American, we have biases. We don't treat all of us the same.
Right.
So
I've been with him for a while, but I don't see.
now you've been with that doctor's office, but that doctor's office haven't been with you.
Right.
It's like you're fighting, but you don't feel as though they're fighting for you.
Yeah. Because I'm telling you the truth right now. I'm telling you the truth. Because the way they, when I feel my sugar up, I take that medicine. Mm-hmm. I ain't been taking no medicine in a while. Because they don't want to pay for it. Now they sent me, about 3 weeks ago, they sent me some metformin, 500 milligrams. I'm at 1,000. They want to give me what they want to give me. I'm about the insurance.
They didn't tell you to take 2?
Well, twice a day.
Yeah.
Yeah, twice a day.
We know what the metformin at 500 milligrams.
That's regular.
But that's not unusual. A lot of what they do, because it actually on the system, it actually costs less. It costs less to give you 60 500 milligrams of metformin than it is to give you 1,000. It actually is the difference in cost. So what they may be doing to control costs is telling you to take 2 a day, which is a 500 and 500 give you 1,000, versus telling you to take the 1,000, because the 1,000 is significantly more expensive.
You don't 1,000, 1,100.
Say what? 1,100?
It's 1,100.
We need to get you some support in that, because that's a pretty high dosage, don't you think?